Hi, my name is Tiara Andrews. Today I will be discussing ANA's Code of Ethics, sections 3.1 to 3.6, which is provisions 3, and I will give nursing scenarios and state whether the scenario followed this section of the Code of Ethics or didn't follow this section. So first, we're going to start with section 3.1, which is protection of rights and confidentiality. This states that the need for health does not justify unwanted intrusion into a person's life. A privacy right to control access to info pertaining to oneself and to control the circumstance, time, and extent in which info is disclosed. An example of this would be if a nurse is signed on to Epic at the bedside and leaves the room without logging out of Epic, and the family member goes scans the computer and see that the MAR was left open, and that the patient is taking like HSV or HIV medications, and make that correlation of a possible diagnosis. That scenario, sections 3.1, protection of rights and confidentiality, will be violated. Moving on to section 3.2, which is the protection of human participants in research. This states that a patient have the right to choose whether or not to participate in research as a human subject. An example of this is working in labor and delivery. We deal with women that are induced for fetal demises. A part of the fetal demise program is a bereavement package for Rachel's gift box. You get a picture, handprints, fingerprints, articles of clothing. Um, Rachel's Gift has access to reach out to you annually on the anniversary of your fetal demise, invite you to walks and um, support groups. You sign a consent and check all the applies. So if you don't want to be contacted each year, reminded of this hard time, then you just check that you do not want that done, and we have to abide by that. And Rachel's Gift has to abide by that as well. Next, I will be moving to section 3.3, which is performance standards and review of mechanisms. Section 3.3, performance standards and review of mechanisms, which states ongoing acquisition and development of knowledge, skills, practice experience, disposition, commitment, relation maturity, and personal integrity for professional spaces. So, an example of this, I will say, is a new nurse grad. As you know, I work in labor delivery. A new nurse grad completes their orientation for their new specialty, which is labor delivery. Upon the end of the orientation, she expresses that, hey, I'm still uncertain about a lot of things. I'm not comfortable fully going on my own as of now, and requesting an extension for her orientation for things that she's still struggling with in the aspect of labor and delivery. But since the hospital is so short staffed, they give her a solo assignment anyway after expressing that, hey, I'm not ready to be alone. And she makes a critical med error, which puts the patient's life in jeopardy. This would be an example of this section being violated. Next, we will move to section 3.4, which is professional responsibility and prompt culture of safety. Again, professional responsibility and prompt culture of safety. This states that near misses and errors that occur, nurses must follow institutional guidelines and report in such events to the appropriate authorities to ensure responsible disclosure of errors to patients. An example of this, I will share a personal example. We had a patient at work that got an epidural, and typically after an epidural, some of the side effects is your blood pressure or your pulse dropping extremely low, or the baby is just not tolerating the medication, showing variables in late decelerations. Our order is to give ephedrine, 10 milligrams every 10 minutes, and call the anesthesia after the third dose is given. At the bedside while helping another nurse, she reconstitutes the ephedrine. The ephedrine comes 50 milligrams in 1 milliliter. The instructions is to reconstitute in 4 milliliters of normal saline, making it 10 milligrams in every milliliters for a possible of 5 total doses. In a hurry, being anxious, being scared about the baby, about the mom's blood pressure being extremely low, she pushed a full 5 milliliters of ephedrine, which was the total dose of 50 milligrams, when it should only have been 1 milliliter and 10 milligrams. I automatically, as an experienced labor delivery nurse, I had her stay at the bedside, cycle her blood pressure every 15 minutes, had her contact the manager and the anesthesiologist and the doctor, and she completed a RL, which is an incident report in our facility. This would be an example where I witnessed the med error. I made sure proper protocols were followed, and the nurse followed those protocols as well. So this would be an example of where this section was a scenario where this section was, you know, followed. Sorry about that. The next section I want to move to is section 3.5, which is protection of patient health and safety by acting on questionable practices. Again, protection of patient health and safety by acting on questionable practices. This states that nurses must be alert to take proper action in all instances of incompetent, unethical, illegal, and impaired practices. Another example I would give is, let's just stay with the patient at the bedside who just received anesthesia, epidural maybe 2 hours ago. She's experiencing intense breakthrough pain, and the epidural feels like it's wore off. Our protocol is to call anesthesia. Hey, this patient is experiencing some pain, even with the epidural, a high pain level 9 and 10. Can you give her something for breakthrough pain? They typically come in with like a little small bolus dose of fentanyl just to help take the edge off. In this case, the CRNA is witnessing pulling normal saline and fentanyl, but only pushing the normal saline and signing out that the fentanyl was given. The nurse that witnesses it speaks up to the CRNA, follows the proper chain of commands, and completes an incident report. This would be a scenario where Section 3.5 was not violated, it was followed through appropriately. Which moves me to Section 3.6, and we can use the example that I just gave as an example for this section as well. 3.6 is the patient protection of impaired practices, which states nurses must protect the patient, the public, and profession from potential harm when practice appears to be impaired. So, as mentioned in the previous scenario, the CRNA was performing impaired practices, and the nurses did what she was supposed to do by speaking up, following chain of commands, and completing an incident report on her end. All right. And my reference for this presentation would be the American Nurses Association 2015 Code of Ethics for Nurses with interpret statements. I'm sorry about the handwriting, but if you can see, the citation is there at the bottom. I will also include it in the text box for submission. Thank you for taking the time out to view my video presentation.